CGTN, China Global Television Network.
Now, during 2016 alone, the African continent experienced disease outbreaks that included yellow fever, cholera, dengue fever, and other infections. And all this in the wake of the Ebola outbreak in West Africa. And so to deal with these crises, earlier this year, the African Union launched the Africa Center for Diseases Control and Prevention in partnership with member states. It has the strategic priority to strengthen health-related surveillance systems and establish diseases intelligence hubs around the continent. So will Africa now be better prepared for future outbreaks of deadly diseases such as Ebola? And what further steps can be taken to improve health in Africa? I'm Beatrice Marshall. Welcome to Talk Africa. The Africa Center for Diseases Control and Prevention will operate on a decentralized model as a network with the headquarters in Addis Ababa and close links with 5 regional centers in Egypt, Nigeria, Gabon, Zambia and Kenya. Each collaborating center will be equipped with laboratory and advanced diagnostic capacity to rapidly detect both known and unknown pathogens. CGTN's Girum Chala spoke to the African Union Commissioner for Social Affairs, Amira Efadil, to find out more.
Thank you very much, Commissioner. The idea of Africa's own Center for Disease Control is a milestone, as we all know. In fact, the big question is, why has it taken so long, considering the frequency of epidemic outbreaks in this continent?
The CDC as an initiative started in 2013 in the summit of the heads of state in Abuja. They've taken the decision of establishing Africa Center for Disease Control and Prevention. From 2013 up to now, it's only 3 years. We have a functional institution. So if I am talking about the time, it's only 3 years between the beginning of the initiative and now we are having it as an institution that functions and have a very clear vision on how are we going to continue with this project. It's not late. It's not late. Because even before that, we have our institutions in dealing with such situations. But I can add that the outbreak of Ebola accelerated the process. The acceleration of the process of having Africa CDC became more urgent, it became a priority to the African Commission after the outbreak of the Ebola.
Now, what is the roll-out plan for these centers for disease control, and what sort of timeframes are we looking at?
This Africa CDC project, we got the approval. From the beginning, it was a summit decision, and we got the approval of the member states, African member states. We have a governing board to this institution. In this governing board, we have the Ministers of Health of Africa, and we have also a representation of our partners. Us as a commission, we are represented with 2 seats in this governing board. We have a strategic plan of action, which is approved, and now we are executing this plan of action step by step. We have our international partners also who are helping us with establishing this Africa CDC. Also, having the headquarters as the headquarters of CDC right now in the main building of the African Union, and working on having our 5 regional collaborating centers in the 5 regions of Africa. This all tells you that we are going with this project because it's a very important one in the Department of Social Affairs, and because it is very important for the African citizen to have this institution for the quick response for prevention of any outbreak of any epidemics in the future.
Broadly speaking, just take us through how Centers for Disease Control work and how they enhance disease surveillance systems, because disease surveillance is what is the main reason why we have the Africa CDC in the first place.
The surveillance system is one of the pillars of the strategic plan, and we are starting working on it from the headquarters now. We have a center. This center is following every minute what's going on the continent, and they are trying to collect information from member states and to be ready before even outbreaks could happen. Also, we are working with establishing and operationalizing the regional centers. We still have challenges on having centers or health institutions on every member state level, and this is a very big step. We are going towards this step. We need to have these systems on the member state level. These systems is going to feed into the regional systems, and the regional systems would feed the information into the headquarter Africa CDC. This system, we are still working on it. As I told you earlier, the plan of action is being executed by our department, by the CDC itself. We are following up very closely as a specialized and concerned department. We are putting this Africa CDC project as one of our main priority projects for the 2017 and the 2018 plan of action for the whole Commission.
What immediate and long-term benefits for Africa do you envisage of the Center for Disease Control?
You know, the benefit is, the first step is the prevention. Preventing any outbreak of disease and preventing the loss of lives. You can ask yourself, and I can ask myself, what will happen if we could have this center before the outbreaks that happens in the past? We could minimize the risk, minimize the loss of lives, and we know that this loss of lives is causing Africa suffrage. It has impact on our, it has an impact, that social impact, it has an economic impact on our continent, and we need to have this center in place to prevent any future outbreak of disease, and also to have a quick response. Because if it happens and we are prepared, we'll have a quick response, and the quick response also will minimize any cost or minimize any loss of lives or any damage could happen by the outbreak of any disease.
There are certainly major resource and expertise challenges for Africa in this kind of undertaking. What might these be, and where is Africa getting the help from?
We have challenges, we have obstacles, but believe me, if you have the political will of all the member states and you have the heads of states approving and leading, we can very easily overcome all these challenges and these obstacles. And in a very short time, we'll have this institution on the continent level, we'll have our regional offices and centers, we'll have every member state will be establishing its own institution. Yes, we need more support from the member states financially. We need technical expertise, and this is the role of our partners. Also, they are doing this. We have many partners working with us, international partners, UN agencies, all are working with us on establishing this Africa CDC. But I'm very convinced that when there is a political will of the African leaders, then we will have this project as a reality, and we can overcome any challenges that are facing us.
We're going to take a short break now, but when we come back, we'll have more insights into the African Centers for Diseases Control and Prevention, as well as the state of health on the continent. To stay with us. Africa is not one story. Welcome back to Talk Africa. Now, to provide further insight into the Africa Centers for Disease Control and Prevention, as well as the state of health on the continent, I have expert guests standing by. In Lagos, public health physician Dr. Tui Mewabondu, and with me in Nairobi, Dr. Evans Amukoye. He's the Chief Research Officer at the Kenya Medical Research Institute, KEMRI. Thank you very much, gentlemen, for joining us on the program. Dr. Amukoye, let me start off with you, though. Africa is still grappling with the myriad of diseases, some outbreaks. We can remember the Ebola outbreak of 2014 to 2016. Just start by mapping it out for us, though. What happens on the continent when there's an outbreak?
There have been several outbreaks in Africa. Some of them are large, some of them are small. I think the worst has been the Ebola outbreak that was in West Africa, that when it started, first of all, it took long before we could make the diagnosis. And because of the porous borders, many countries were involved before effective intervention could be taken. When there's a disease of an unknown nature is known, or probably there's an increase of a certain disease that we do not know about, what happens is that, first of all, you've got to have the sense of suspicion that this is an odd disease. Then after that, samples will be collected according to the kind of symptoms you have. Symptoms will be taken to a laboratory that has got capacity to be able to do it. Sometimes the capacity may not be there. Then after you make the diagnosis, that's when probably action can be taken, depending on the action that is there. If you don't even have some kind of a program or a plan of how to do it, then you are lost. So that's why we need to have plans in order. We need to have preparedness. You need to have, if it is a very infectious diseases, we need to have the equipment that is that you need, and preventive measures, so that as we actually fight these diseases, we don't kill our health workers.
Right. Dr. Tui, we did see that, of course, in 2014 when West Africa grappled with the Ebola situation. What is the situation now with the medical institutions in West African countries?
Sincerely, it's a pitiable sight, you know, because even the total lesson we should have learned from the Ebola outbreak, we are not learning the lesson. You know, why do I say this? Because if you remember, even recently, we have an outbreak of meningitis in Nigeria, and we're still dealing with that sloppy method of response to those meningitis, and the death is increasing. Now, we know what Africa is. Africa has become like an epicenter of various epidemic outbreaks. You know, today we're dealing with Ebola, tomorrow it might be meningitis, day after it might be Lassa fever. And then you see a population that is more than 1.2 billion, and then still growing, high birth rate. And you see that, you know, every health threat in any part of Africa has the consequence of affecting not just the health system, it affects the economy, it affects the political system, and even creates a security threat. So that is the situation we find ourselves. It seems the lesson we're supposed to learn from the Ebola outbreak, right, we have not sincerely learned it. Now, we must commend the need for African Union to say, okay, we're going to move forward to do something about it. But as we discuss, as we'll see further, we'll see how far those decisions can carry us.
Dr. Amukoye, though, we're talking about we haven't learned any lessons from all the epidemics we've seen across the continent. What is the challenge here? Is it capacity? Is it lack of funding? Is it lack of expertise? What is the challenge?
I think it's a bit of all of them. What requires a lot of political will, and political will can also be shown in terms of funding, actually, because even if you have nice plans and you don't have funding, it becomes difficult for you to react as quickly as possible. And of course, it's also a lack of structures. And I think having something like the AU putting up CDC, it may be easy for me to discuss with countries across Africa. If there's an outbreak of bird flu, for example, like it was there in Uganda, we should be able in Kenya to know what the problems are, and we should be ready and vice versa. When there was an H5N1 threat in northern Kenya, Uganda should be able to know how to react, and it should not be something that you just come from without a plan. So the lessons would be, first of all, building the capacity of laboratories. So we have a lot of expertise in Africa. But you know that a lot of times we need the West to come and do something that the expertise may be in Nigeria, and we are going somewhere probably in Europe and America to get those expertise. So with this particular system, we'll be able to know where all our expertise are, so that in case of a problem, we can actually probably go to Uganda and get expert, rather than waiting for people who will take a flight of another 8 hours to come here and can react quickly. And communication is the other problem, so that when there's a problem, they can be able to communicate as quickly as possible, from either the rural areas to the central areas, and from central areas to the other African countries. And also, when we get the results need to be taken back quickly and in a way that it can actually be acted upon.
Right, and I just do want to come back to the whole question of what happens when outbreaks occur in Africa, Dr. Tuyi. And of course, we're talking about surveillance here, and we did see in Senegal and Nigeria, as a matter of fact, when 2 victims of Ebola arrived, that they were able to come out quickly and deter that. Are there countries, though, that have the facilities, functional surveillance and early warning systems that can be replicated across the continent?
Again, the experience in Nigeria, as far as Ebola is concerned, is that we're a bit lucky that the first case that came, that flew into Nigeria, came to Lagos, where we have quite a large number of human resources for health. Now, if you look at it, Africa is having like 20–30% disease burden worldwide, but the human resources that we're having is less than 2%. Okay, so there's that critical gap, because it's a documented fact that the more human resources you have in a place, the better you're able to respond to such, threat. Now, what happened was that the Ebola team came to Lagos, and good enough, it came to an hospital that had some standard in place that can quickly detect it. You cannot say that of some other part of Nigeria, because, if you look at Africa, majority of the population are rural, and we're seeing the population that is growing, that have a big knowledge gap in terms of what they need to do should they experience this condition. We're seeing the dearth of, even public information system. We're seeing dearth of health literacy. And these are the things that actually can assure quick response to challenges like epidemics. And then if you look at it, the cooperation, like Dr. Evans was saying, the cooperation across Africa is neither there. You look at research funding and research network, even malaria, disease that's burdening Africa, you have to go to Europe to get proper research done. And if you look at the number of people involved in those research, they are mainly Europeans who never have reason to be bothered about malaria. Right. We see quite small number of Africans being involved. So we have the challenge of the capacity to actually, get people involved and work in Africa. We have challenge of incentives, because again, if you look around Africa, especially if I'm talking from the point of Nigeria, right, you see the health workforce getting involved in strike, getting involved in challenge every time they need to ask for additional money.
Right. Dr. Amukoy, though, we're talking about building capacity here, and Africa is talking about having its own Africa Center for Diseases Control. How do you go about setting that up? The capacity,
there are 3 arms. There is a surveillance, public health aspect of it, where we actually catch the disease. Then there's the diagnostic capacity. And right now, like in Kenya, we have very many high-level safety laboratories, but they're not at the highest level. The highest level would be what you call a level 4 capacity, which you do not even have in most of Africa. So we might find that some of those organisms, we take them somewhere else because we don't have the capacity in that particular area. The other one would be availing the materials and logistics. Sometimes we have problems of logistics, where we can be able to move people quickly, evacuate people if we require at a very high speed. And then there's these beliefs of people, because we've got people with different cultural things, because they could decide it's something to do with witchcraft or something else, and they probably might not even trust the doctors or something of sort. So it is something that we require also to deal with the soft side, the qualitative, what you call the qualitative side, rather than just treating the disease itself. So those are some of the capacities. And if you look at training, we do have a lot of Africans now who have done courses up to PhD levels, even postdocs. But sometimes after that, there is no system. There's no way of them getting a postdoc, for example. There's no way of getting funding. As my colleague has said, most of the funding, even for research, you find is for external. We're just lucky recently in Kenya, some money have started now trickling down, right, for actual research. But otherwise, 80–90% of the money is money from the West for research.
Right. When you talk about the funding, if you were to set up, or while we're setting up these CDCs in Africa, where are we finding the funding, though? Where are we looking for the money from?
We hope that the governments from Africa will actually be able to put money there. They also will actually rely a little bit on our donors, probably, which is not bad to start us off, probably like putting up some of the structures. And but in the long run, we cannot rely on donors. we have to rely on ourselves. Like when Africans decided they're going to put 1% or 2% of GDP on certain things for research, or a certain percent, their budget declaration on health, if they actually just did that, that alone would actually reduce some of these diseases and be treated before they become epidemics. And even epidemics, when they come to Africa, they become endemic. You see, when cholera came, it's still here now after so many years. It's something we should be able to clear, and it disappears because our reaction is low. And probably the amount of resources that we put may not be adequate to clear.
Right, and I want to put that to Dr. Tui, though. Why is it, though, that when epidemics occur in Africa, it does take a while to have it eradicated, but there is always a recurrence? And we've just mentioned cholera, for instance, dengue fever, for instance. Ebola, it wasn't the first time that Ebola was on the continent.
Exactly. You know, what we need to do, we need to actually put in place a long-term thinking. That can really situate us and understand the kind of health system we want to run in the continent. Now, this collaborative effort by the AU is commendable, but again, like Dr. Evans rightly put it, we're going to have a lot of challenges in terms of funding. Where's the money going to come from? You want to change the health system, then the question is this, you need money, you need money, you need money. You need people. Okay, where is this thing going, where are this going to come from? We must be able to create a form of endowment that can assure that even the money keeps running and it can be managed appropriately to run the public health system. Now, why do we still have those diseases in Africa? Let's get it straight. If we be able to measure the health literacy across Africa, especially in the rural areas, you know, we'll find out that the health literacy is pretty low. And you cannot, again, eradicate disease without information, without appropriate information deployed to the right place to ensure that, you know, people get to change their behavior appropriately. And then if you look across again, you find out that we have challenges in terms of quality, you know, health system, in terms of the weak health system, you know, that is affecting us. In a way, it's preventing a lot of us from being able to, you know, eradicate some of these diseases. And then not just one disease, you are having, you know, a plethora of different illnesses that can really, you know, spiral into epidemics if you don't do something immediately. So these are the things that is actually, you know, perpetuating diseases in Africa. I mean, our sanitary condition, the habit systems, the building network, the other aspect of the intervention that impacts on health that we need to actually stand up and improve. Those are very key.
But Dr. McCoy, these are issues that we grapple with every day, issues of sanitation, issues of building capacity, issues of controlling this epidemic. But it cannot only be about goodwill, is it?
The literacy which he has emphasized on is extremely important, and it's not literacy of actually people who don't know how to read and write. It's for everybody, so that health is not about health workers. Health is about everybody else, educationists. Health is about the political people. Health is about the religious people who can sometimes become like you saw something in Kenya where people were talking about vaccines, and sometimes even in Nigeria when they were talking also about some vaccines about polio, and some of those things there can actually affect. So it is a whole culture change also. But I still think that the first place to start is the political will.
Right, Dr. Tui, I want to get your thoughts on this African Center for Diseases Control and Prevention. What is the status of it, though? Is it going to enable Africa, as you may say, because you've been talking about we've had all these epidemics, but we haven't been able to control them. Is this going to enable African countries now react better when we have an epidemic?
Yeah, it's nice for us to have that Africa Center for Disease Control, because I cannot really imagine. We have universities for years, for, you know, centuries in Africa. We train doctors. We've seen at the point in time many doctors from Africa have actually functioned properly, even at the level of WHO. But what is happening nowadays is that, you see, we have doctors, still we ship those doctors abroad to go and function, and then we abandon Africa. Now, the political will is so important. The major challenge of health policy, if this CDC is to function in Africa, the major challenge will actually still be political will. You know, because, again, you look at it, in the past 5 years or thereabouts, you know, 10 years or thereabouts, 5-10 years or thereabouts, now we had an improved in economic growth, more than, you know, 200% GDP growth in Africa. But that didn't, again, translate to increased life expectancy, okay? When you compare our growth to that of South America, which the life expectancy was able to, to improve after the GDP growth. We are talking about weak health system. There is also weak health system in Thailand. There's also weak health system in Jamaica. But still, they were able to add something substantial to their life expectancy. Look at Africa, for instance, if I may talk about Nigeria. The life expectancy is just about 51 years, and it was just 49 years, some years back. But we've not been able to use the money we accrued in our improved GDP to affect our health system. So beyond, for this thing to succeed, the Center for Disease Control in Africa to succeed, we need that, first of all, that political will. We need to look for the fund. We need to mobilize people, not just at the level of donors, but even at the level of people in Africa that can actually bring the money and ensure that we develop our institutions and create a way that the institutes that can produce vaccines, the institutes that can even help in epidemiology, the institutes that can even develop cheap technology that can enhance health system and health behavior.
Right.
We must be able to do that, and we must be able to, across board, synchronize and link ourselves together and be able to share information. Africa must be able to learn to trust themselves. They must be able to learn to trust their institutions. That is very key. Right,
Dr. Abukoye, your final word, though, in order to improve Africa's healthcare system and in order to improve Africa's surveillance and reactionary time when we do have epidemics, what other steps need to be taken?
I think I'm taking from where Dr. Tweety said, because we need to believe in ourselves. That's the first thing. Because a lot of knowledge, we have the knowledge, but sometimes we don't believe in ourselves. So if we believe in ourselves, and I believe that I can get assistance from Uganda, from Rwanda, it'll be the first step. And so once we start believing in ourselves, we are ready to exchange information freely across the borders. After all, human beings in Africa, they don't know about those borders. Animals, human beings, birds, they go across. And sometimes some of these things are brought by things like the bird flu was brought by birds coming across. There are animals that, like the bats, where they don't have borders. So the first thing, apart from the political will, is that they should now put money. They should actually decide that this institution that they're setting up will work. And will work means that we put in the right people, and we make sure that the right systems are there, the communication between the countries are there, the countries trust each other and believe in themselves, then trusting people outside. South-South relationship has been fairly poor compared to the North-South, mainly because some have the funds and others consume the funds. I think we should find ways in which we can use our own funds across the South-South relationships.
All right, Dr. Abukoye, thank you very much. We'll leave it there for the moment, and that's all we have time for this week. But thank you to my guests for their insights. In Lagos, a public health physician, Dr. Tuye Mewabondu, and in Nairobi with me, Dr. Evans Abukoye, Chief Research Officer at the Kenya Medical Research Institute. Thank you very much for joining us on the program. And do remember, you can join the conversation online through Facebook, Twitter, and YouTube. And do join us again next week for more Talk Africa. Goodbye.